Representative Lee moves House File 3699 to bring that before us. And so, Representative Lee, if you can please present your bill.
Great. Thank you, Chair and fellow committee members. This morning, I'm presenting House File 3699, which would appropriate one-time general fund dollars to support the continuation of a very successful child care facility revitalization grant program that has helped centers across the state be able to enroll 7,000 more children. Originally established in 2021 and funded with American Rescue Plan dollars, the Facility Revitalization Grant Program has improved the safety and quality of thousands of childcare settings across the state, hence these 7,000 new seats. As we've heard in this committee in the preceding weeks, the infusion of funds from the pandemic The infusion of federal funds from the pandemic helped address existing issues that were only exacerbated. And as COVID assistance funds phase out, families and organizations across Minnesota are turning to the legislature. To address the ending of ARP funds for this program, House File 3699 would appropriate $18 million to continue the Facility Revitalization Grant Program for an additional 3 years. And while we've heard many proposals for how the target in this committee could be used to reinvest in our state, this revitalization program would arguably give the state one of its best returns on investment. With an average grant award of approximately $9,000, program grants would bridge the financing gap, particularly for small, rural, and BIPOC-owned or culturally specific providers who often struggle to find private sector funding. This morning, I have with me Suzanne Pearl from First Children's Finance, the organization that DHS contracted to administer the program. I'm going to turn over to her so that she can provide more details on how this program differs from other child care facility grant programs, and she'll be able to share more about the unique aspects of the program and how it's benefited grantees.
Thank you so much, Ms. Pearl. Welcome. Please identify yourself and proceed.
Good morning. My name is Suzanne Pearl. I'm the Minnesota Director for First Children's Finance. Thank you, Representative Pinto and members of the committee. I'd like to thank Representative Lee for authoring the bill. I'm pleased to have the opportunity to speak with you today about the Minnesota Child Care Facility Revitalization Grants Program. All available funds have now been granted, and I'm here to share the successful results of the program and why we believe it should continue. The program began with an appropriation from the 2021 legislative session using one-time American Rescue Plan Act funding. In designing the program, and after engaging directly with child care providers, we wanted to ensure that funds were equitably and widely distributed. To that end, unlike other child care grant programs, funds are provided upfront rather than a reimbursement and do not require a match. And this is the first facility-focused state grant program that licensed family child care providers have been able to apply to directly without a fiscal agent. The program set an award cap of $20,000 for centers and $15,000 for licensed family child care. Tribally licensed child care was also eligible for this program at the same funding level per provider type. We held competitive grant rounds about every 3 months, 8 rounds in total. Applications were evaluated based on how much the funds would impact health and safety of kids, whether they address licensing needs, and the level of child care need in their location, among other factors. If awarded a grant, grantees received 90% of the award up front, and they had 6 months to complete their projects. They then had to submit receipts, documentation, and photographic evidence of their completed project to receive the final 10% of their award. If they spent less than the full award, or we discovered that some of the funds were used for ineligible items, they would not receive the 10% payment and/or would be invoiced for the difference from their initial 90% payment. We are happy to report that the grant compliance rate has been very high for this program.
And hey, Ms. Pearl, I'm just going to pause you for a second. For members and members of the public, the second half of the packet that we have includes a report called Minnesota Child Care Facility Revitalization Grant Impact Report from December. And I'm finding that useful just as to see, and I would encourage other folks as well. It should be in the second half of you should have a packet that has some letters in the front, but then the second half of that packet contains this report. So sorry to interrupt. I just thought folks would find that useful.
No, thank you, Mr. Chair.
Please continue.
Of the more than 2,700 child care businesses who have received grants, to date, only 20 have been referred to DHS for noncompliance. We also had an independent audit of the program done last fall, which was successfully completed with no findings. In total, we awarded more than $31.2 million to 2,725 unique child care businesses across Minnesota. The average grant award size was just over $9,000. 69% of grants went to licensed family childcare providers, and 31% went to childcare centers. 58% of grant dollars were awarded to businesses located in Greater Minnesota, with 42% awarded to businesses in the 7-county metro area. And across Minnesota, 15% of grants were awarded to childcare businesses whose owners self-identified as people of color. Grants were used for a variety of projects and equipment, with the majority of funds used to repair or purchase flooring, fencing, outdoor play areas and play sets, appliances, and windows. The total enrollment of the 2,725 childcare businesses receiving funds is more than 67,000 children. That's 67,000 Minnesota kids who are now benefiting from safer, healthier environments. This grant program also resulted in an increase of almost 7,000 new childcare slots, which is fairly amazing, since due to federal regulations, we were not able to use these funds to build new facilities or to expand the size of any existing facilities. But these small grants had a big impact, helping childcare providers to make better use of their space so that they could increase enrollment within their licensed capacity. We've heard from countless providers who have told us how much these grant funds have changed, not just the financial sustainability of their business or their ability to even stay in business, but they also stress how positively these grants have impacted the families they serve. Minnesota can and should be proud of this investment in childcare facilities. We are asking now for funding to continue the program on a smaller scale to provide grants for childcare programs who now and will continue to need support for facility repairs. This program complements and does not replicate other existing state supports, including the DEED Child Care Economic Development Grants and the Great Start Compensation Support Payments. The Facilities Revitalization Grant Program provides equitable opportunity for all child care programs in Minnesota to ensure safe and healthy facilities for the children in their care. Thank you, and I'm happy to answer questions.
Thank you so much, and thanks for your work. And this report is really helpful, and it's great to see the impact that's. I'm kind of amazed by the numbers. So more than 2,700 businesses and nearly 70,000 kids. Anyone else who wishes to testify on this bill? Member of the public? Not seeing anybody. And so member discussion, questions. Representative Coulter, you're up.
Excuse me. Thank you, Mr. Chair. And really, I just want to say thank you, Representative Lee, for bringing this forward. I introduced a strikingly similar bill, which led to some awkward conversations earlier this year. But I think this is an important conversation because I think it gets at some of those other sort of less realized costs of running a childcare business and making sure that providers can serve kids. I've told this story before, but I talked to a provider, I think in Mountain Iron, who had to spend $600 to fix her fridge because it was a few degrees too warm. And that all goes into how sustainable a childcare business is. So I'm just really, really pleased that we're having this conversation and hope that we can do something this year. Thank you.
Thank you so much. Any other member discussion? And so seeing none, Representative Lee, final words on your bill.
Great. Thank you, Chair. Like I said before, I know it looks like we have a really big target, but we actually don't. And I know we have limited ongoing funds. And so if the committee were to consider, where to put these dollars to get the best return on investment for the state, I would suggest House File 3699.
Thank you so much. Okay, and thanks, Ms. Pearl, to you and to all who've been working on this. I remember when the program got set up and just really excited by the impact it's had. Thank you so much. So with that, the chair lays over House File 3699.